industry faces a lot of challenges, and amongst them, workforce management plays a very crucial role. To overcome these challenges, healthcare professionals will need a strong vision for the future and the ability to act on it. It gives me immense pleasure to call upon Dr. Moopen, who will guide us through the same.
Good evening, everybody. Let me first of all thank Symbiosis Management for inviting me the third time to present in front of the students as well as invited delegates on a subject which is quite close to my heart. Before I go into this, let me just give an overview of what I am going to do. I am told that I have about 1 hour, of which 45 minutes could be for the presentation and about 15 minutes for question and answer. I will be looking at the subject which is very, very important from a perspective of the India scenario rather than overseas where I am based. Why I am telling this is, there is definitely a lot of similarities, but there are a lot of things which are different also. So I don't want to confuse. I am just giving one slide towards the end, giving some salient features about the overseas workforce management related matters. Otherwise, I'll be mostly focusing on the India scene. And it won't be something like how do you manage a hospital workforce. It will be little more from above a look at what actually is happening and what should be done. It's a macro view rather than a micro view into the HR practices as well as the day-to-day HR management. Now, many times people ask you, it may be people from the industry, people from press, the media, or your investors, stakeholders, what is the greatest challenge, doctor, for you for running an organization like this? We have about 10,000 people working in our institutions, equally divided between India and GCC. So I tell them that the greatest challenge is 3 P's. The 3 P's are PPP, which usually we call for public-private partnership. But these 3 P's for me are people, people, people. In healthcare, I can tell you there is no greater challenge than people challenge. And all the challenges other than people challenge, like the challenge of capital requirement, the challenge for logistics, the challenge for technology can be overcome, but people challenge is a great challenge which each one of us must be aware of. And I am very happy that you are all in a safe place. The students here, the people who are aspiring, job aspirants, people who are coming into the market, you are all in very safe place because you are in a domain which is highly sought after and which actually is looking for opportunities for getting more and more people. So my first slide is just to tell you to smile because you are in a very safe place. 1 out of every employed person in the Western world is in healthcare, and our country is not far behind, and we will be moving towards this target and we will be reaching there. So we are all in a field which is very, very lucrative from the point of view of looking at our prospects. So we can smile because we are in such a situation. We are not in a situation where we should be running around looking for jobs. But there are certain realities. Let me come to that. What are the challenges that we face? The challenges that we face in healthcare HR are mainly, if you look at the shortage of people, the unequal distribution, and the increasing cost. The shortage of people, we all know, is a reality. Whenever we look for qualified people, experienced people, we find it extremely difficult in spite of the large number of people coming out. We find it extremely difficult to get qualified and experienced people. So, if you look at the projections, for the year 2020, it's projected that we require about 1 million doctors and about 2 million nurses and about 10 million healthcare managers, paramedical staff in India. This is a huge number. You will understand the intensity or the gravity of this when you look at the number of doctors who are coming out of the medical colleges in the country every year. Out of the 350 or 360 medical colleges in the country, 40,000 doctors are coming out. And the requirement now itself is 600,000. There is a gap if we have to reach the minimum number of doctors as prescribed by WHO, which means it is going to increase, and there is a huge challenge. So that's a huge challenge that we all are facing. Take it, not only doctors, nurses, paramedical staff, managerial staff, anybody you look at, you will find that there is a huge challenge, and that's a widening gap which should make all of us sit tight and look at. I'll be coming to few things like the solutions towards the end. I don't want to discuss it now. We will discuss it as we go forward. Now, another very, very important thing is the unequal distribution. This is a major challenge. We all know that. See, if you look at the picture there, if you are able to see that, the one that's marked in red are areas where there is a huge deficiency of healthcare personnel. And unfortunately, our country falls into that. The developed world, the Western countries, even the thickly populated, densely populated places like China doesn't have a challenge like that. But we and African, sub-Saharan countries, and some of the countries in the South America have got a huge challenge regarding lack of trained manpower. And what's the reason for this? Unfortunately, from these countries which are marked here, people are migrating to the countries which are much better off financially, as well as they are capable of producing their own graduates. But what's happening is the reverse. People are from these countries where there is a scarcity like our country. A lot of people are going into countries where there is already fairly good medical care, health care, but they require more people. They can pay more, so people move to such places. So migration is happening from poor countries to rich countries, and that is actually a very, very sad thing. Now, another type of migration is happening. This is something, I have put a quotation from Lancet here, which you can read. Another migration is happening in India generally in all areas and even in healthcare is that people from the rural areas are going into the cities and there is a scarcity of people in the rural areas for providing healthcare. This is another very sad fact and this is something which has to be addressed. So there is an unequal distribution due to this migration from country to country as well as inside the country itself. Now, we know that another major challenge for talent acquisition is the increasing manpower cost, where many of the institutions, especially the governments, find it difficult because of the better salaries in the private sector, as well as larger institutions paying more and smaller institutions finding it difficult to get qualified people. So there is a demand-supply gap, and people who are paying more get people. People who are not able to do that don't get the required qualified people. So there is a demand-supply gap. And one very paradoxical thing, if you look at, is that there is a requirement if you want to attract a doctor to a peripheral hospital. We have hospitals in many of the tier 2 cities and tier 3 cities. If you want somebody to go to the tier 3 cities from a metro, then you have to pay more. It has to be the other way around because the cost of living should be higher in a metro. But it's not like that. If you want a qualified person, doctor, nurse or paramedical staff or a healthcare manager to shift to a peripheral hospital, then the demand for salaries are more, which again skews the whole thing. And it makes it difficult for us to get people onto these places. It's not only salary, there are other reasons also, like children's education or availability of any sort of entertainment, things like that also prevents healthcare professionals to go to the rural areas or to the peripheral areas. Now, another challenge, the first challenge is the acquisition challenge. Another challenge which I want to just highlight is about the performance management which we are facing as organizations, professional organizations, as we are moving forward. See, the traditional ways of promotion on the basis of just seniority, as happens in government or even private sector, is disappearing. People are now looking at ways in which actual capabilities of people can be assessed on the basis of appraisals. And this is very much possible in many other industries, whereas in healthcare, it's not that easy. Because healthcare, even though it is a science, it's also an art, and there is a lot of non-measurable things which are there when a person practices, starting from the doctor on to the even person standing in the front desk. So there is a challenge for actual appraisals. How do you appraise somebody? How do you decide where this person is capable? How can you compensate him? This is a big challenge. So this is a challenge which HR managers are facing when they come into healthcare. Now, the KPIs are becoming much more than the job descriptions, key performance indicators. And you find that there is a difficulty in assigning key performance indicators in many areas of healthcare. So this is a challenge for many healthcare managers. And there are also challenges when you engage doctors. Doctors earlier used to be on a fixed salary or on a consultation or a visiting consultation basis. Now it is changing. There are other units being employed, right, like the relative value units being used in the United States and all, where depending on the actual capability of the doctor to provide a specified skill, the doctor is being given the weightage or better salary. So that again is a very complicated activity which again is producing difficulty in appraisals and assessment. So this is a challenge, real challenge for HR managers or people leading healthcare business. Now, another major challenge in healthcare, as I see, is in the training area. In training, we find lot of mention about continuing medical educations, continuing nursing education, and such programs and all. But how effectively this is being utilized and how many doctors, how many nurses get retrained after they finish their courses is a question mark, big question mark. And this is something, a big HR challenge. Training people, especially in subspecializations, is a big challenge for many of the institutions. Now, there are specialized areas where again it has become more important, like in quality accreditation and matters like that. It's very, very important that the accreditation areas as well as the quality areas are given importance, as well as medico-legal areas and many very important areas which people should know. But again, you find that these areas, it's not easy to provide training by a normal healthcare institution. So these areas are important to be focused by healthcare institutions if you have to have your staff really trained for the future. Now, other new training challenges you will find in IT-related areas like HIS and EMR. EMR is a major area where many people are not able to actually understand it or implement it. In many of the hospitals, you find it extremely difficult to put in EMR or electronic medical records and make it digital. So training people in such areas is becoming very, very difficult. Then there are new things like insurance becoming more prevalent, and there are a lot of coding activities to be done, and there are a lot of requirements for fulfilling the insurance requirements. You also have new areas like health tourism, where you should also be looking at training in languages, cultures and all, if people have to properly work. So these are all real day-to-day challenges that an HR manager faces when he is running a healthcare institution. Now, another challenge which is there in healthcare is the retention of talent. How do you retain talent? When there are opportunities outside, when people are having much more better salaries outside the country or in other institutions, how do you retain talent? It's very difficult. The only way in which it could be done is by assuring that they have certain benefits. So many of them leave because of the lack of growth in the organization. They are not able to find ways in which they can grow up and go forward in the career. That is one of the major reasons why people are leaving. You also find poor communication and mentoring as another very important reason, especially the reporting authority. If he is not listening or able to mentor the person, that's a major challenge where people start leaving. You also have the lack of recognition and rewards. Even a good word, once uttered, will be much more important than an increment or an increase in the salary. Unfortunately, this is not understood, and people actually leave because of the lack of recognition. And there are also issues regarding the appraisals, which I mentioned earlier, very arbitrary appraisals which make people leave. So this is one area. If you want to retain, you will have to look at these areas so that there is actually more of retention of people. You might have, some of you at least might have read the book by Vineet Nayyar, about employee first and customer next. We always used to think that it is the customer first and everything else follows. What he says is that it is the employee which is the most important asset. And if you take care of the employee, he will take care of everything else. If you haven't read that, I recommend strongly that you should read that beautiful book, that is Employee First and Customer Next. Yeah, I just want to mention that there are challenges for getting people into the government. There are a lot of advantages of being in government, and our forefathers always wanted to be in government service, stability of job, whether you perform, don't perform, underperform, once you are in, you have a very stable job. So that was one of the major advantages. Then there are other benefits like pension, retirement benefits and all, which is not there in many of the private sector organizations. But in spite of that, people are not now that enthusiastic to go into government sector, and there is a lack of people in the government sector, and mostly it is the career growth and training opportunity that is not there which has produced this. This is not even the salary, even the salaries have gone up in government sector in many areas, but the lack of professional management is something which unfortunately is driving people away, or at least not attracting people into the government sector. Yeah, this I just put a slide there to break the monotony. This is something which I saw recently. All of us think that Monday is the day when you don't want to, even look at the most least popular day of the week, continuously for many years according to somebody. It may be something exaggeration, but I think that tells the message that people don't want to go to the work, which is not a good thing. You must have the enthusiasm to go to work. That's the primary thing. The whole idea of me now coming on to is to tell you that this is very important that you develop passion in what you are doing. Now, this is just, I told you that I'll add one slide on overseas recruitment, because we have large number of employees overseas, and it has got its own challenges. There are many challenges. Some of you might have tried for overseas jobs or maybe already taken overseas. We take a lot of people from Symbiosis as well as from other institutions. We find that the graduates of Symbiosis are one among the best that we have selected, and we are very happy with the people who have come. And even this year in our institutions in India as well as abroad, we have taken a large number of students from Symbiosis. Now, there are challenges like the delay. It takes time for somebody to get the visa, process the papers, go through the accreditation examinations and all to come abroad. And there is also issue regarding job stability, again, not with us, but many of the institutions. It's very arbitrary. After 2 years, people can just tell you to go away, which is another thing. And there is another very important thing, de-skilling, especially among doctors. This happens, and the inability to get good quality doctors in the Middle East countries is mainly because of the de-skilling, because of the very low number of population, and that population also mostly healthy, because these are expats who come there from the age of 25 to 55, the healthy age. The major illnesses are less, and you don't get opportunity to do procedures or operations on very complicated surgeries and things like that. It's very limited. So because of the lower number of people, because of the cases being not that complicated, you find that many of the doctors, many of the highly skilled nurses and all don't want to take up employment abroad, because they get de-skilled very easily. If they have to do 15 angioplasties a month, and if they are able to do only one or two, maybe they will get the same salary or even better salary, but they are not willing to come. This is a reality. May not be for healthcare managers, but for doctors and other people who have to use their hands for skill maintenance. It's a very important thing, de-skilling. So I just want to come to the closure of this by telling you about the way forward, certain thoughts which I have, what could help in improving the situation. There's no point in just telling about problems and telling that these are the challenges. At least, if I can tell you few areas which not you maybe, people sitting here may or may not be, even at the level of the governments, the press and all, if they can highlight, if they should be looking at ways in which at least some of the challenges which I mentioned could be addressed. These challenges, to some extent, are actually international. As I told, we have the issue of the brain drain. We lose a lot of people to outside countries. And this is true with many of the developing countries, many of the sub-Saharan African countries, many of the poor countries. So actually, I think this effort that is being put in, the money being spent, the institutions being built for training these people, and suddenly these people leaving, even though it may be beneficial for that particular person, it is a huge loss for the country. So, as a social commitment, it's important that we ourselves take that decision that we serve the country at least whenever possible and for sufficient number of years. But more importantly, I think that there has to be international recognition of this, and people being taken, trained people in any profession, not only medicine, any profession, there must be a compensation for the country which is losing that from the countries which are gaining that, either by the government or by the employer who is gaining from that, or from the employee who is going there. It's a very important thing. If you look at our country, which has got this huge manpower deficiency, going forward, if we start losing people again and we are not able to build up our healthcare system, that's a very sad situation. So I'm not saying that there should be roadblocks put on people going abroad. We have to, through the WTO, through such negotiations, see that when people who are trained in a country for 15 years, 20 years, 25 years, including their schooling, suddenly somebody gains that whole brain just by paying some few dollars extra, that shouldn't happen. At least there must be a compensation for that. So that's one very important thing which we all have to keep in mind and we all have to argue for. Now, promoting reverse brain drain is something which institutions here can do. We have to have the platform for these people to come back. Many of them want to come back. They don't want to stay in countries where they have gone. Maybe at that point of time they wanted money. But they want to come back if there is a proper environment, proper institution here. We see a lot of doctors as well as other people in the medical profession who want to come back because of many compulsions. When the children grow up, they don't want those children to be exposed to the culture of those countries. They want them to be brought back and to be brought up here. Or they have ailing parents, father, mother, or elder relatives who require their attention. They want to come back. There's an urge to come back. But there has to be a platform. There has to be a place where they can practice at the quality levels, at the standards which they are exposed outside. So it's very important that good institutions, quality institutions, ethical institutions are built here, which can actually reverse the brain drain, as happened in IT. In IT, there has been a huge reverse brain drain which happened. We gained a lot by that. In healthcare, you will be surprised, there are 100,000 doctors from India in the United States. 100,000 doctors. In the small emirate of UAE, where I am based, there are 1,200 doctors from the state of Kerala practicing in the UAE. So these people, they will come back, they want to come back, and we have to create an ambience for them to come back and aid that reverse brain drain, which is the responsibility of the private sector as well as the government. Now, we talked a lot about the scarcity and what should be done. There are great institutions like the Symbiosis, which are doing great work in areas in healthcare management courses and all. This should be taken as an example, and there should be much more institutions taking this up. The government and the statutory authorities must relax the rules to start courses and institutions. There is no point in hanging on to something which was built many, many years ago or something written many, many years ago and saying that this is sacrosanct and has to be kept like that. We run a medical college in Kerala, and I was so sad